Hello everyone, this is Dr. Jayanthy Ravindran from Tamira Plastic Surgery. In this episodes of video, let me take you through all the procedures that are available for a facial contouring. I will start from non-surgical to advanced surgical procedures like deep plane facelift. So let's start with what are all the non-surgical procedures that are available for facial contouring, because now the era is moving towards non-surgical or minimally invasive procedures for facelifting, starting from a very younger age to those that were there for ages, advanced surgical procedures like a classical SMART facelift or a deep plane facelift. So with either weight loss or aging in the face, there are few things that actually changes. So there is fat loss, fat descent, the laxity of the retaining ligament and skin laxity. So how do we correct these problems either non-surgically or using minimally invasive procedures? Now when you say there is a fat loss, we have to replace volume. So to replace volume, I'm sure all of you have heard about fillers, which are hyaluronic acid, or we have temporary fillers, semi-permanent or permanent fillers. So these are used for restoring volume, and of course, what is your natural filler? It's fat grafting. So for volume restoration, you have one of these options, either synthetic hyaluronic acid, which are called as fillers, or your own fat grafting for volume replacement. The next is, if you have good volume, which is very common in the Asian skin, especially South Indian skin, we are more bulky along the lower face and the neck. So it's more than the volume loss, it's volume descent. So now we have to reposition this volume back to where it actually descended from. So then one of the best, you have energy devices, and we have all of these devices are just tool in a surgeon's hand. So when it is a descent of the volume, we do not use these energy devices to cause further volume loss. Instead, it has to be more focused towards tightening. Now when you want to lift a descended fat, it has to be not just tightening of the skin, you also have to tighten the fibroseptal network or the retaining ligaments for it to move up. So for that, the current options include Endolaser, which is Endolift, which can be used both for lifting as well as fat lysis in specific areas where we are not able to lift those fat, or there's excess fat and you want to lyse them. Another good option is thread lift, and some of the threads that we use at Tamira are from Aptos threads, which come with woven hyaluronic acid. So it not only lifts the retaining ligaments and the descended fat, it also keeps releasing hyaluronic acid to rejuvenate your skin as well. So to lift the descended tissue, you can use Endolaser, you can use threads, and of course you also have radio frequency. Next one is the skin tightening. So for skin tightening, the two best technologies to be used is radio frequency. So you have heard of Morpheus 8, Skillfirm, all of these use MNRF, that is micro needling radio frequency. The settings, it's not that every MNRF works the same way. You should be able to control different settings if you want specifically skin tightening by collagen remodulation without fat loss. So these are the non-surgical option. Of course, if you feel the face is bulky and before we do a contouring, you want to reduce fat, then you also have the ultrasound, that is high intensity focus ultrasound, to reduce fat. But usually when it comes to correcting the aging process, it's actually starting from volume replacement, lifting the descended tissue, tightening the fibroseptal network, and tightening your skin by collagen remodulation. Now these are non-surgical and minimally invasive. Now let's move to surgical correction of them. Let's say you buy an extra large dress and you have now lost weight to almost small. So the only way you can make the dress fit to you is to cut and remove the extra cloth. Similarly, if there is significant skin laxity, none of these non-surgical or minimally invasive procedures can help you tighten all the excess skin, and in that case, a surgical procedure is definitely required. So while we do surgical facelift, one of the drawbacks or flip side in South Indian skin is the scars, because we tend to pigment or the scars can become hypertrophic. Usually these scars are hidden. Their scars are placed along your hairline and very close to your ears, and it goes behind your ears. So when they heal well, then it's good. It's not visible. But in South Indian skin, when we are trying to, most of us like to put our hair back, we wear the kondai, and we like to wear flowers, and then these scars have to be really concealed and it should not be pigmented. So when it comes to facelift, you have different techniques. You have what we call max facelift. So I learned this technique from the inventors of these max facelift, Dr. Tonard and Dr. Wapale from Ghent, Belgium. So they are the pioneers who invented the max facelift just to avoid complication and also at the same time give good results by combining multiple procedures. So a minimal facelift with fat grafting, with skin rejuvenation, all combined together will almost give you a great facelift result. But of course, you need to know all these facelift results can last also between 5 to 7 years, maximum 10 years. And if you start early, you might have to do a second facelift. Now, the next advanced technology when it comes to facelift is called the SMAS lift, where we have a superficial musculoaponeurotic system in the face. The fat, muscles, retaining ligaments, they come as a composite unit. And so if you're only lifting the superficial musculoaponeurotic system, leaving the deeper muscles, that's called a SMAS lift. So SMAS lift is less risk factors compared to a deep plane facelift, but again the longevity can be lesser than deep plane facelift. So again here with SMAS, you can have just a scar along the hairline in just along your ears or extending back to include a neck lift as well. Now the next advanced one is called the deep plane facelift, where we go under the cutting the muscle and lift the whole musculoaponeurotic system with the SMAS as one unit. Should be done by really skilled surgeons experienced in doing this. Risk factors involve nerve damage, and of course once it's lifted and sutured, very less tension along the suture line, because otherwise the suture line tends to get stretched, hyperpigmented or hypertrophied. When after a great facelift, if you have a hypertrophic scar or a pigmented scar, then the whole results actually appear to be masked. So if you are considering a facelift or you've already done a facelift, I'll be very happy to hear what sort of a facelift if you have done. Please leave your comments below. And if you're looking at a facelift and you feel that your skin has sagged, send us your photograph and we will tell you which procedure will be ideal for you. Of course, the deep plane facelift is the master of all, can give you a very natural result. And now there's a lot of talk about Kris Jenner having had a deep plane facelift. I really don't know, but that's what the media says. Very natural result. This is a second facelift, but it looks more natural than from the previous one. So we have a wide range of procedures for facial recontouring. And if somebody starts maintaining their facial skin from a very younger age, probably 25-30, and you can delay the surgical facelift to even beyond 50-60 years, or you may not even need them in future. So if you have any other question, please leave your comments below. And this is Dr. Jayanthy Ravindran from Tamira Plastic Surgery.